Hi there, I'm Stephanie Crowley with the Canadian Security Magazine team, and today I'm speaking with Kashiv Parvez, the Chief Information Security Officer at University Health Network. Nice to meet you, Kash, and thanks for joining us.
Nice to meet you, Stephanie. I'm glad to be here. As you said, my name is Kash Parvez, and I am the Chief Information Security Officer at University Health Network here in Toronto.
Perfect. So let's talk about security in terms of patient health and why that's so important.
Yeah, for sure. So it's not just patient information. Patient information, for sure, from a privacy perspective, you want to maintain all of that patient data and patient records. Hackers out there are really looking to leverage that for identity theft and to do other sorts of transactions. Take over someone's identity to make financial transactions on the credit card. We collect a lot of information through giving care to our patients. So we have an obligation, rather, to protect that information. And then the other issue is just maintaining the actual operations of the organization. So the clinical operations that run the hospital.
Let's get into the details here. What security challenge was UHN facing that precipitated a search for a new security solution for you?
We had an in-house, what we call a SOC, a Security Operations Center. We were running that in-house with our own staffing model. However, we found that challenging in the sense that it was hard to staff on a 24/7 basis. To attract talent who would want to run those shifts overnight and on the weekends, as well as getting people trained up. So to not only hire them, but also get them useful as far as our systems are concerned, our alerting systems, and getting them up to speed. I think one of the things that was said best, I think, from one of our provincial counterparts was that hospitals are in the business of making patients better. They are not in the business of running a security operations center.
I can imagine that kind of ongoing relationship would be really important to a client such as yourself with such a magnitude and the amount of data as you spoke to earlier across the different hospitals within the network. So in terms of choosing a solution provider, how did you go about this? And what kind of particular skills or expertise did you land on with Calian that really, stood out to you and eventually turned this partnership into a success?
There was a rigorous RFP process that was followed according to public sector rules. And there was several organizations that were in the running, and then there was a very detailed review of all of the services, including, past customers. We did a lot of reference checks on folks as well who were past Calian customers as well, or continuous customers, as well as the service itself. Reach within the healthcare sector. They have a very proven track record in doing this for other organizations as well. And also I had the opportunity to visit the SOC overseas, and they were very welcoming and very open to hearing feedback from customers. I think that they and they have a great customer success team, so they are always engaged in everything that I've asked for. They keep that as it's not just like, well, I heard it, but I'll do it whenever and that sort of thing. They keep that as a top priority, and they follow up on it and every request that I make. If it's too large a request, maybe it does require a change request, but even that is told up front. Everything is noted and worked on right away. If it's a smaller request or if it's a larger request, then we think about it. But I feel that I have a voice there, from the voice of the customer, getting back to optimize the solution to better meet our needs.
What have you seen in terms of results so far that are kind of proving to you that the Calian system is working?
It's a funny story, actually. So my team was they were just wanted to test something. They ran a quick scan of one of the systems, just as we were looking at a different solution for penetration testing, a service. And so we just had a POC going, and so overnight, one of my internal UHN teams ran the thing just to test something out, and they didn't tell the overseas operations team, the MSSP, and immediately within like 5 minutes or something, we got an alert coming back, and high escalation from them saying, "Hey, I see something and dangerous happening," and that sort of thing. And so they were right on top of it. I think that it's given us a level of comfort as far as knowing that overnight, weekends, everything, incidents nearly always occur on a Friday afternoon or over the weekend, or like in the middle of the night. I've been on several of them before. where it's, I'll be like just getting ready to unwind for the weekend, and then you get this thing that we have some sort of a cyber event. So it's great to have the organization 24/7, looking all the time, alerting when necessary. And we are looking to expand some of the services. I know that managed security service provider is one portion of it. There are other services such as identity protection and taking over credentials and that sort of thing that are also being explored that Calian can offer. If they're not just a managed security service provider for me, they are also our incident response firm. So when there are incidents, if there is an incident, they engage incident response through another portion of the team to get on the line, get onto the bridge, contain the issue, find out what's going on, and try to restore operations very quickly. So they're still part of our response team as well. So it's not all just detection; it's detection and then response as well.
Wonderful. Well, Cash, thank you for joining us today and sharing your insights on your experience with Callian.
Thank you so much.